My name is Mark Lee. I have been a nurse for 3 years. I'm a nurse scholar at Emory University Hospital's 7E Complex Medicine Unit.
My name is Betsy Augusti. I work at Emory University Hospital, Unit 7E. Mark is one of my staff members. He's one of my favorite employees and on 7E Complex Medicine. Mark is a servant leader. He leads by example. Oftentimes, he volunteers to float to other departments so that the other people can be more comfortable on his team. Mark is involved in many unit-based committees, hospital and also system-based committees. He makes sure that nurses' voice is heard at a higher level. Mark precepts employees when we have new employees. Although he's been only into nursing for 3 years, he's now a nurse scholar. He volunteers to precept other nurses and mentors them.
We all need someone to lean on at times. And so as a preceptor and as a mentor, it's about listening to what that person needs and responding the best way that I can. One of the unique things about being a nurse is that you get to speak to the community too. And during the pandemic, I had the opportunity to be a real live nurse on Disney Junior's Doc McStuffins. We did an episode called The Doc Is In, and it was all about getting our audience to wash your hands. I remember taking care of a gentleman who'd been in the hospital for several days. I went into the room to introduce myself, and I asked him, "Sir, what is your goal for today? What can I do for you?" And he looked at me and said, "Today, the goal is to go home. I have tickets to see Billy Joel in Madison Square Gardens tomorrow." To get the patient home that day, we worked as part of a team to do a number of things. He needed imaging done, he needed equipment delivered, and he needed to know how to take care of himself and his condition at home. And at the end of a long day, as I was printing that discharge paper, the patient was beaming. He was going to get to go to see rock icon Billy Joel with his wife, who I call the Uptown Girl.
The moment I met him, I knew he was going to make a difference. One of the patients commented at one point when I was making leadership rounds, he said, "Mark is a true nurse. He is everything a nurse should be."
When I get in the elevator and I come up to the floor, I don't know what's there for me, but I know it will be an interesting day and you have the chance to make a difference for someone else.